Doing two presentations in one today because there's a lot of different things that I am passionate about, that I teach, and I have 1 hour. So I picked two topics, and hopefully they will be of interest to everyone. So a little bit about me. I taught at the Maryland University of Integrative Health from 2003 right up until pretty much when I moved down to Florida, which is where I live now. And for about that much time, I have been teaching facial and cosmetic acupuncture classes internationally. So, East, can you see my slides? I just want to make sure. Okay, good. Okay, so when I teach cosmetic acupuncture, I have a basic 2-day weekend certification for cosmetic acupuncture needling. Then on day 3, I teach facial cupping and gua sha in the morning, and in the afternoon, I teach my advanced needling. So you're going to get a little flavor for the advanced needling. And I have separate courses for derma rolling, skincare. I also teach treating neuromuscular facial conditions for things like Bell's palsy, trigeminal neuralgia, TMJ, MS, stroke. And this incorporates scalp acupuncture, facial motor points, things of that nature. I have a 2-day course on the anatomy of expression, which has to do with the emotional roots of I'm a classically trained Worsley 5-element acupuncturist. So everything that goes on here shows up here. And so this course is really designed to be able to look at people's faces and understand what's going on with them physically, emotionally, and vice versa. And I also have a class on facial acupuncture self-care, and this is designed mainly for acupuncturists, but there is a cupping and gua sha piece, which is for non-acupuncturists. My advanced class is geared towards hard to treat conditions. I have a safety class, and stay tuned to the end of my talk because I also have an ethics in facial acupuncture class, which I am going to be teaching. It's brand new. I'm going to be teaching it online next weekend. And because I love to have an audience when I'm teaching online and not just be talking to myself, I am offering a discount to anyone who is on this webinar. My advanced certificate program is a culmination of my almost 20 years of teaching. Essentially, so everything I teach is available as a recorded webinar. So you would watch the recordings, and then you have the opportunity to show up for a hands-on needling class. And every month we do a 1 hour just mentoring session, which is also optional. And everything, all the recordings, the hands-on class, the mentoring is all approved for NCCAOM, Florida, California, CEUs. These are a few of the publications, my publications in the Journal of Chinese Medicine, and my very first talk right now is going to be on submuscular needling and scalp. It's not scalp acupuncture, which I do teach for the face, but this is scalp needling for cosmetic and neuromuscular concerns. So let's hop right in. What is submuscular needling? Submuscular needling is something that we can do to help to improve both the function of the face by increasing the blood and chi flow to the facial mimetic muscles. And it can be used to relax muscles that are too tense or to bring energy to muscles that are too, so we have muscles sometimes that are too tense, and then we have muscles that are too relaxed. And when we're talking about the face, we tend to use our facial muscles a lot. So they tend to be very tight. So it can help to bring blood and chi to those muscles so that they're not so tight. But also, if the muscles are flaccid, if they're not functioning well, it can help to bring blood and chi flow to those muscles as well. It can also, by doing submuscular needling, it can help with nerve entrapment, which can happen if the nerves are entrapped in the facial fascia, and I'll show some photos of that. And it's really good for long-term facial paralysis. Your patients who maybe had Bell's palsy many years ago or stroke, but they still can't move part of their face. If they have ptosis with their eyes, any sort of tension in their jaw, in their head, by doing submuscular needling, this can be extremely beneficial. And submuscular needling can be used in conjunction with other techniques like scalp acupuncture, cupping, gua sha, facial motor points, or it can be used as a standalone technique. So here is a picture of the skin, and I apologize, I didn't hear Shelley's whole speech. I don't know if she already talked about this. I was frantically driving around the DC Baltimore Beltway to get here. So Shelley, I'm sorry I missed your talk, but I apologize if this is repetitive. But our face is the only place on our body where the muscles are attached to the skin. So here we have skin, and on most of the face, not everywhere, but most of the face, we have some fat, and then we have muscle and then bone. On the rest of the body, the muscles are attached to other muscles, they're attached to tendons, they're attached to joints, they move things, right? But they don't come out to the skin level, which is why if you go like this, you can't move the skin on your arm no matter how much you try. You have to move something in order to get the skin to move. Whereas on your face, you can move your lips, you can move your forehead, you can move your cheeks, and you don't have to move any bone. So as we get older, our facial muscles become shorter, tighter, and that's why we can get some of these lines across our foreheads, down our foreheads, around our lips, on different places of the face. However, the muscles on the scalp and sometimes on the neck can become weak, they can become shortened, and muscles anywhere on the body can have a reduced blood and chi flow, but specifically on like everything from here to here. And any changes that happen in the facial fascia is going to affect the facial muscles. So here we have muscle, fat, we have fascia, which is deep, fascia, which is superficial. And then on some places on the face, we have more fat, and then the skin. And you can see that the nerves are invested right in between these layers. And here we have the mimetic muscles, and this is called the SMAS layer, the superficial muscular aponeurotic system. And this helps to move our face around. So when they do a face lift, sometimes it's called a SMAS lift, and they it's crazy, but they literally make a cut in front of the ear and they just pull everything back. They loop it back around the ear. They cut some muscles in back of the ear and they just tighten everything up. And that's why people can get that windswept, surprised look on their face. So here's just another picture of what I was talking about. It's kind of a side view, and you can see all the different layers on the face and the SMAS layer and how it goes all the way from right underneath the jaw all the way up to the around the temporalis area. So I had mentioned fascial adhesions. If the fascia, which is this layer right here, if you think about chicken, when you pull the skin off the chicken, you've got that white stuff that's really, really tough to cut when you're trying to take the skin off. That's the fascia layer. So this can become very stiff, and by needling through it, you can really help with any fascial adhesions, which can cause nerve entrapment, which can in turn cause a loss of facial function. If you think about someone who's very young, when they smile, their whole face lights up, right? All the way up to here. You think about a baby or a young child. When we're much older, let's say in our 80s, this fascia gets very stiff and hard, and we can pretty much like smile to here, but the lighting up of the face doesn't tend to happen because things just get stiff and they just don't move the way they did when we were younger. If the nerve entrapment is severe, it can prevent us from making certain facial expressions. If someone, for example, had Bell's palsy and they didn't use a part of their face for a very long time, then after a while, that part of the face can become completely paralyzed. People that have trigeminal neuralgia and tremendous facial pain, there's a lot of different instances where the nerves can become entrapped, and using submuscular needling can really help to get things moving. So the theory is by using either submuscular, in some cases it'll be intramuscular, like with the masseter, you really can't get underneath the muscle, so you may go through the muscle. But by needling either under the muscle or through the muscle, it can increase the blood flow and chi to the area, break up the fascial adhesions, and stimulate the collagen production in that area as well. When I teach my class, on submuscular needling, I go through all of these different muscles, the auricular muscles, temporalis, the platysma, masseter, anterior digastric, the frontalis, the procerus, and the levator. But given how much time we have, I just picked my top 3 I thought would be most interesting to you guys. So let's start with the auricular muscles. So when I teach my basic 2-day cosmetic acupuncture class, I talk about the auricular muscles, and I teach needling of the auricular muscles because these can be really monumental with lifting the face. And anyone that you know that can wiggle their ears, you'll notice when they're wiggling their ears, their whole face lifts up. So any of us could actually learn to wiggle our ears and use these auricular muscles. Just hop on YouTube, or I'm sure there's a TikTok video for it. But using these muscles, which are vestibular muscles, we don't need them. When we were animals, we used to use them to move our ears, but now they're there, but they don't do much. But by needling underneath them, you can help to give the face a little lift. And it's also great because these muscles are connected to the temporalis. It's great for people who have like those gallbladder headaches, or people that have tinnitus, any kind of jaw pain, ear pain, any sort of issues. So everything that I do, it's not just cosmetic. I believe in treating the skin and the spirit, and also any sort of neuro or muscular issue that your patients have. So by learning cosmetic acupuncture, you're not just taking care of their skin, but you're treating their spirit and also helping to keep everything moving, right? Because that's what we want to do, is keep that rice pot lid going, because that's what chi is. So there's 3 auricular muscles. There is the anterior, the superior, and the posterior. And the anterior connects where the ear connects to the head. The superior is kind of up there between 11 o'clock and 1 o'clock, if your ear were a clock. And then the posterior is right here behind the ear. And what you would do is take a needle and you just slide it right underneath that muscle. And it doesn't even matter because you're threading. It doesn't matter if you're going front to back, back to front. You just slide the needle right under the muscle, and it helps to increase the blood and chi flow to the area. So this is kind of what it looks like. And I have a little video. Hopefully it will play for you guys. There are 3 muscle groups that we are going to work with. The first is the anterior auricular muscle. And the easiest way to find this is you just pull the ear. And when you pull the ear, it's actually where the ear attaches to the head. The next is so that's the anterior. Then we have the superior auricular muscle. And the interesting thing about this muscle is the size and the position can be different on different people. So on some people, it's a very small muscle, but on others, it can be large, but it's a muscle that fans out. So we have anterior and superior, and they can be very, very close to one another. And then the posterior auricular muscle is typically very easy to find because when you pull the ear, you'll see the tendons, or actually the one tendon that pull on the muscle itself. So again, anterior, superior, and posterior. The way that we're going to needle these is I like to use a 1/2 inch needle. And depending, so your patient will be lying down on a table, but you can either go front to back or back to front, and you are going to use a guide tube. You're going to point the guide tube. You're going to hold it flush to the head. You're going to push the needle in, remove the guide tube, and then you're going to push the needle in so that it goes underneath the muscle. So that is the anterior auricular muscle. And then for the superior auricular muscle, you're going to do the same thing. You're going to hold the tube flush against the head. You're going to push the needle in, take the tube out, and you're going to place the needle all the way up to the handle underneath the muscle. Okay. Lastly is the posterior auricular muscle. And again, it doesn't matter if you go top to bottom, bottom to top, you pull the ear forward, you're going to hold the tube flush to the head, you're going to push the needle in, and then just push it down underneath the muscle. If it is underneath the muscle, there will be no pain at all. If you go into the muscle, there will be pain because the muscles have a lot of nerve endings. So you would do this first before you did anything else. And then you can go ahead and you can do your auricular points. The one auricular point that I do want to show you is the endocrine point. And so lung is here. Okay, we know where the lung point is, but the endocrine point is just forward a little bit to the lung point. So it's going to be lateral to the lung point. And this is a great point for treating any kind of hormonal issues. And it looks like that. Okay, I'm looking at the time here. I'm going to have to talk fast. Okay, temporalis. So the temporalis is a large muscle that's on either side of our head. It helps us to chew, and it can be very much involved with any sort of headaches and jaw pain. It also helps to lift the face up. So in my advanced class, I recommend needling this if someone has a lot of sagging and drooping and you've been treating them and just things are not picking up. The fascia is very superficial, and essentially you're going to needle right around the border of the muscle. And here are some photos. One of my students did this. One of my students did this. So just to give you an idea of what that looks like. And I'm going to for the temporalis muscle, the idea is to find the outline of the muscle. And it tends to be a very large muscle. It runs all the way from the back of the skull, all the way around the front of the face. And you're literally going to take the needles and you are just going to work your way around the entire line of the muscle. And depending on how tolerant your patient is, you can use you can really thread like 20 of these into this area. I'm just doing a little demonstration here. So I want you guys to get an idea of what this looks like. And it doesn't really matter which direction you're going in. What matters is that you're getting, again, underneath the muscle, and that you're working your way all around the perimeter of the muscle in order to relax it. And they should have a nice little circle around the muscle when you're done. And this will really help to relax the temporalis muscle if they have TMJ. Pretty much anything that affects the face, the temporalis muscle helps to pull the face up. I use this technique sometimes in facial rejuvenation when I teach my facial rejuvenation classes, because the temporalis muscle can really lift up the face. I'm just going to do one more. Again, I'm using Sarin 1-inch needles. So that's what that looks like. So for the okay, last but not least for this lecture is the levator muscle. And the levator muscle is this muscle that helps to lift the eyelid up. And if your patient has hooded eyelids, if they have ptosis, this was a patient of mine who she was complaining that her brows has started to fall and her lids were starting to close up. And so here's like mild ptosis, you can just barely see it. And here is a more severe ptosis. And oh, let's go back to this patient. This patient of mine, I treated just one eye, and you can see how much more lifted her brow is in this picture. And this was another young patient of mine. She was getting married, and she said whenever she gets tired or if she's sick, if she's run down, her one lid always would droop. And after about 6 treatments, was able to get her lids to even up. And here is what I do for that. Like really like this. What I'll do is I'll pull up, but for her, I would just use the tube and push underneath the brow like that. So again, I'm not on the lid, I'm underneath the brow, and you know why they call this yow, don't you? Mm-hmm. Ouch. Yow. Yow. So essentially, like, by needling, taking the tube, pushing it under the brow, you're just catching the edge of the levator and you're causing a lifting action within the eyebrow. I would combine that with like gallbladder 14 as a motor point, maybe gallbladder 15, and then I would thread from bladder 4 back to bladder 6, and it just opens this whole area up. Okay, so that's submuscular needling. Now on to my my current favorite topic. I always have a favorite topic. This is my current favorite topic, and that is microneedling. So, no, I don't know what happened here. So microneedling is in most states in the US within our scope of practice. And it is a wonderful alternative to getting injections like Botox and filler. It can help with fine lines, any sort of depressed scars, acne scars, stretch marks, pock marks, um, anything that is not raised. It can help with skin laxity, enlarged pores, like on the nose, on the chin, crow's feet, lip wrinkles, dark spots, melasma, and it can even help with hair restoration, and I am a living testament to that. So what does it do? How does this work? Essentially, you have a pen, or it looks like a pen, and it has tiny little needles that go in and out of the skin very quickly, 16 to 18,000 revolutions per minute. And it helps to stimulate your body's own collagen production. It will increase the absorption of any products, serums that you use on the skin by up to 1,000%. There is very little downtime. It is very low risk. It's highly effective. It's all natural. You're not putting anything into the skin or taking anything out of the skin. And it's great for the neck. The neck can be so hard to treat. The chest area can be so hard to treat. And it's relatively comfortable. It's not terribly uncomfortable. And the results can last for a long time. So how does, I just wrote an article, I think it's coming out in Acupuncture Today in July, but I am going to most likely expand it into a much larger journal article. But how does it fit within our scope of practice? Well, if you think about how we use needles and how in Chinese medicine, needles have been used to beautify the skin for thousands of years. And even though some of the terminology and the tools are different, microneedling is very similar in principle and in practice to something like maybe circling the dragon to treat a scar, or using intradermal needles, which I actually do use in my practice. I limit it to 5 to 10, and I use tweezers, and I can work pretty quickly, but microneedling is great because if you have patients who have lip wrinkles, crow's feet, things of that nature, you can do that entire area and not have to use all the little intradermal needles. But using microneedling is similar to a 7-star hammer or a plum blossom, and for treating hair loss and skin concerns like wrinkles and dyschromia. So if you think about the 7-star hammers that we use that are used to treat blood stagnation, neuropathy, scars, alopecia, microneedling can do the same thing. If you think about intradermal needles that we put in superficially to bring qi and collagen to the skin, microneedling can do the same thing. Techniques that we might use when we're treating the face, like threading or surrounding the dragon, to help to release stagnation, fascial adhesions. Well, maybe it might not go down to the fascia layer, but to help to regrow healthy cells, microneedling can do the same thing. So microneedling can mean with a pen, or with a derma roller, or with a derma stamp. And so one of the principles of Chinese medicine talks about the connection of the harmony of the body, right? We've got the skin, which is related to our internal organs. By stimulating the skin, it can help with our internal health as well. So when I teach microneedling, I don't just teach microneedling, I teach how do you put together a treatment protocol which encompasses both doing the microneedling and the body points to help to build or move qi, to build yin, bones, blood, move stagnant fluids, and really bring the person into greater health in addition to just treating their skin. So how does it work? The needles that break through the very superficial layers of the skin, these little microchannels, they will stimulate a healing response. And when your skin knows that it's been damaged, it repairs itself and it will create more collagen. And having more collagen makes your skin firmer, tighter, can help with the acne scars, hyperpigmentation, hypopigmentation, and fine lines and wrinkles. And you really can do microneedling anywhere. In my practice, mainly I do the face, the neck, the chest, the back of the hands, but you could use it anywhere you have stretch marks on the legs. You could use it on your elbows, your knees, anywhere where your skin is kind of loose, because it works very much on a skin level. And the philosophy, the underlying science and philosophy is by creating these little microchannels, there's this inflammatory response that happens, and the body will heal itself with new, brand new, healthy skin. So this is kind of a cross section of microneedling pen causing a little damage. And these are temporary channels. There should not be bleeding. Forget about what you see on social media. There could be some tiny pinpoint bleeding, but that's not what we're looking for. What we're really looking for is just some redness and very superficial. These fibroblasts are created in the epidermis, in the basal cells of the epidermis, and it does not mean that you have to bleed. The other benefit is by creating these little microchannels, whether you're derma rolling or using a microneedle pen, it helps your products. Normally we put product on our skin, right? And it just kind of sits there on the skin. It has no way to get in. So if you're putting vitamin C on your skin or collagen serum or hyaluronic acid, you want it to get in, right? You want the hyaluronic acid to absorb moisture. You want the vitamin C to act as an antioxidant. You want the collagen to get in there and build new cells, but our skin is a barrier. So by needling, it creates these temporary little microchannels, and the products can get in and repair damaged cells, create new cells. Here's a biopsy that was taken of a cross-section of skin, and they dyed the collagen purple. And then 6 weeks after microneedling, they took another cross-section and they dyed the collagen purple, and you can see how much more collagen there is. So again, the needles just go to the epidermis. It only has to be performed once a month, and you don't have to go very deep. The depth depends on the area you're treating, and you're going to do different sorts of treatments for different conditions, for different places on the face. So you'll have one sort of technique you might use for deeper wrinkles, one technique for dark spots, one for fine lines, and one for scars. It is beyond the scope of my lecture right now to go through all of them, but I'll just talk about one. And it's funny because I use this terminology. I've been using it for almost 20 years when I talk about gua sha of the forehead. I call it the Mr. Clean Magic Eraser, but it also conveys when you're using a microneedle pen, if you're working in a deeper area, like between the eyebrows, around the lips, you would spread the wrinkle, and then you're going to take your microneedle pen and literally kind of erase the area that you're dealing with. So this is great for the eyebrows, crow's feet, around the lips, and between your eyebrows. Nanoneedling is a different tip that you would put on the microneedle pen. I actually have my stuff here with me, but I don't have time to dig it out. So there are these tiny little nanoneedles that they're like 1/1000th the length of microneedle. There's no downtime, and you can do it. Here I say twice a week. I probably do nanoneedling like every other day. It's a nice exfoliation, especially as you get older. Keeping the skin exfoliated is great. The nice thing about nanoneedling is you can do it inside the orbital rim, on the red part of your lips, places where you normally would never microneedle or dermaroll, and it helps to increase the absorption of your serum. So I find that normally when if I just put serum on, if I don't dermaroll or nanoneedle, and I put serum on, eventually, you rub it in, it gets in. But if you do nanoneedling and then you put your serum on, it like automatically absorbs. It's quite amazing. And again, there's no redness. So the microneedling treatments from start to finish is really about a half an hour. If you so desire and your patient so desires, you put on numbing cream, stays on for about 15 minutes. You take it off, use some body points to keep your patient grounded, treat any underlying conditions. The whole treatment itself takes about 15 minutes. And normally it's like 4 to 6 sessions, spaced once a month. Quick comparison contrast for microneedling and cosmetic acupuncture. So microneedling is very much skin level. Fine lines, scars, again, inside the orbital rim, multiple lip lines. Sometimes people can see results right away. Usually it takes a few treatments. It just depends on their level of aging. I'm not even going to say it depends on their age, because some people who are younger have advanced signs of aging, and some people who are older don't have a lot of signs of aging. So depending on their constitution, their diet, their lifestyle, their genetics, where they live, it will determine how many treatments it's going to take. And there is some downtime with microneedling. Your patient should not be going out that night. They're going to be pink like they have a first-degree sunburn, sometimes a second-degree sunburn. Usually by the next day, certainly the day after, they're good to go, but there is some downtime. The results are very long lasting once they've had a series. With cosmetic acupuncture, you're working with the root problems, you're working with the muscles, the fascia, the blood, the chi. It's much better for like sagging, for jaw lines, jowling, deep signs of aging and drooping. And you're going to have to treat your patient probably 6 to 8 times before you see any real results. And it is less painful. You don't need numbing cream. And there's no downtime. Your patient can leave a cosmetic acupuncture treatment and go about their day. No one will know that they've had cosmetic acupuncture. They're both within our scope of practice. They both increase collagen and elastin. So here was a patient that I did some microneedling on. This was before, during, and after. You can see they were just kind of pink. There's no bleeding. And after about 4 or 5 treatments, these spots had kind of broken up, flaked off, and disappeared. And here is a demo. This one's a little longer. It's about 2.5 minutes, but I sped it up so that you can kind of see it. This is, again, this is not a training. This is an overview. My training is 4 hours long, and it's included with the pen if you purchase an AccuLift micro pen. So there you go.
So Barb has some numbing cream on her face. I am going to remove it with a makeup remover wipe that I spray with alcohol. And then I put some serum. I like a hyaluronic acid, vitamin C, collagen serum, and then sometimes I will add in some peptide serum. The pen I am setting at a speed of 5, and the faster you higher the number on the pen, the faster the needles will go up and down. I move the pen left to right and then up and down about 1 inch per second. It is important that you hold the pen straight up and down, and I go back and forth over the area until it is slightly pink, and then I move to the next area. If there are any dark spots, I dab at them with the pen. You can also go over the eyebrows. Microneedling can help to grow hair. You'll notice that I'm adjusting the needle length now that I'm no longer on her forehead, making the needles a little shorter so that I can work around some of the more sensitive areas. And you need to check in with your patient to see how they're feeling, and also look to see if you're getting enough of that pink. Make sure you get in front of the ears, and when you are working, constantly looking back at areas you previously worked on and reworking them if necessary. And in addition to going up and down and left and right, I will go in little circles, especially around on the chin area. I want to get in all those lip wrinkles around the top lip, and I will spread the wrinkles out if they are very deep. And so once you've done one side of the face, you do the other side of the face, and then I cover the face, making sure to cover all of the areas up and down, left to right, little circles. And then I cover the face with an aftercare product of arnica, aloe, and CBD.
So Why do you need training? A lot of people just want to buy the pen and be done with it. And they just want to figure it out themselves. In the training that I do, I go through contraindications, setting patient expectations, the needle speed, the needle depth, how to measure the skin thickness so you know where to have the needles longer, where to have the needles shorter, different skin conditions, melasma, acne scars, hair loss, precautions, pre-needling, techniques for needling different conditions, different areas of the body, and what to expect for your patient post-treatment, any possible side effects, and also marketing. How do you market this product, and what do you do about before and afters? So here's a couple of before and afters. Patient had acne scars, and this is afterwards, some fine lines on the side of the face. These are my eyebrows. So I was quite surprised. As you get older, everything falls down, falls off, falls out, falls apart, dries up. You have hair where you don't want it. You don't have hair where you do want it. And one of the places where I did not have any more hair was my eyebrows. So I had been told that needling the eyebrows could help. And so here's the before, and here is the after. I was not microbladed. There's no powder. You can see my eyebrows now. It's been a while since I've done them, but just from microneedling my eyebrows, I now have eyebrows, which was very exciting for me. So pricing examples. I set my prices usually at $325 a session. I do a package of 4 for $1,200. It's going to depend on where you are in the country, how much you charge. I either do 4 or 6 sessions. It just depends on how far gone their skin is. Like, do they have a lot of damage, a little damage? What is it they're trying to accomplish? And some other pricing options, and I go through this in my class, you could just do brows or mouth area. What I will do is I'll do microneedling if they have a lot of wrinkles here, but not a lot of wrinkles here. They just need some lifting. I might do cosmetic acupuncture here, and then do some microneedling here. You could do neck, chest, hands, other body parts, elbows, knees, stretch marks, and price it accordingly. Now, devices. What do you want to look for when you're buying a device? They need to be a minimum of 14,000 RPM. Most devices that are worth anything are 14 to 16,000 RPMs. You want the tip to be a bayonet tip, which means it's not just like a little pointy tip. The bayonet tip looks kind of like a hatchet. I'll show you a picture, and it goes in and then you twist it, and so it's locked in there. Versatility, you want a cord, and you also want batteries, and that way if the batteries die, you've got the cord. Easy to recognize settings on the pen, good warranty. The Aculift Micro Pen comes with a 2-year warranty, product support. And I had someone the other day, they dropped their pen. They literally had it a week. They dropped it. It broke. It wasn't working. And she contacted me, and I had pen that was missing a label. I just sent her a pen. I charged her $50 for the shipping and the packaging and everything, and she was so thrilled. So, you know, can you pick up the phone and call who you bought the pen from and get the support you need? Training, marketing material. So this is a picture of the Aculift micro pen. It is manufactured by the same company that makes my Aculift derma rollers, which I've been selling for, I don't even know, since 2008, I think, a long time. It comes in a stainless steel case, 2 batteries, a charger, and the plug with a very large instruction manual for my old eyes. It comes with nano needle and regular 16-pin microneedle cartridges, and this is the LED readout. So when you push this little button, it tells you how fast you're going, so you know. And I'm not going to have time to go through all the details. You can go to my website, aculiftsskincare.com, and you can see all the information about the nano needles. This is what the nano needles look like. They barely even look like needles unless you're looking at them under a microscope. They're like little cones. And the system itself comes with a patient take-home kit, so aftercare products for your patient with instructions for them. And it also comes with all the serums and aftercare products for your back bar, and comes with brochures and training and 2-year warranty. And I also, anyone who purchases from me, you get listed on my Find a Practitioner thing on my website, so people can find you once you've been trained by me. And this is just my brochure. Oh, and also stuff for your website. So you don't even have to design that. You just cut it and paste it right onto your website. And this is the whole Aculift family. You can find all of my Aculift products at aculiftsskincare.com. All of the Aculift products are endorsed by the American Acupuncture Council. So if they are your insurance, you are covered if you are using these in your treatment room. And here is my social and my websites. But essentially, if you go on Facebook, LinkedIn, Instagram, and you type in my name, you'll find me. Also, my classes are at facialacupunctureclasses.com. And I do have a Facebook group for those of you who are still on Facebook. There's about 8,000 acupuncturists. It's only for acupuncturists. And the group is called Facial Acupuncture. Now, here is that special offer. Next Sunday, is it Sunday or Saturday? I think it's Saturday. Next Saturday, June 25th, I am recording my ethics class, and I hate talking to myself for 2 hours. So the class is CEUs pending. Hopefully it'll be 2 CEUs. If you need to meet your ethics requirement, you can do a facial acupuncture ethics, and it's only $20. And I'm only charging just because I have to pay someone to do the CEUs and all the registration and everything. So if you go to my website, that registration is open, and I am making this available to you guys. So that's it. I just made it.